again, thank you all for joining us. My name is Lucy Latu. I'm the Assistant Director of Taulama for Tongans, a community-based nonprofit organization here in San Mateo County, serving the Native Hawaiian Pacific Islander community, not only in this county, but in the greater San Francisco Bay Area, California, and beyond. Thank you all for taking the time to join us, for wanting to learn more about us and about the tools that UCLA Center for Health Policy Research, the NHPI Data Policy Lab, has blessed us with. Um, and we're truly grateful for, because as you may or may not know, without data, well, data is the language that government speaks and entities like that understand. And as much as the community voice and the community story is important, I always say that it's community voice or perspective or the story without data is like a hamburger without the bread. It's just the meat and the fixins. It's messy to eat. However, data without community voice or the community story is like just the bread, dry. And in order for one to get the full picture or full understanding, especially of the community, is to have both. And that for our NHPI community, we have not been able to be seen in data because it's not disaggregated. And that issue causes us a huge disservice. It actually means lives, if anything. I know it sounds really drastic or morbid, but it's true, especially with the pandemic, that where the NHPI community, not only here in San Mateo County, but in other parts of the nation, where we were had the highest morbidity rate, and the highest vaccination hesitancy and everything else in between. And so I'm hoping that today's webinar will help you understand our community, and then help us to fill the gaps and to bridge the gaps, so that way our community can access the services and the resources that are supposed to be available for all of the community. But thank you again for joining us, and I am really touched. And I know that this is just the beginning, and I hope you understand that this is just the start of the conversation, and there's much more to talk about, and there's much more to do. So with that, I'd like to start to go into the land acknowledgement. We, Taulama for Tongans, respectfully acknowledge that San Mateo County rests on the unceded ancestral homelands of Ohlone peoples, including the Ramaytush-speaking communities of the peninsula, such as Salsan, Urebure, Yelamu, and Lamshin, as well as the Muwekma Ohlone tribe, among other Ohlone descendants who maintain ties to this land. We honor their living relationship to these lands and recognize the injustices of colonization, past and present. As Native Hawaiian and Pacific Islander peoples who now call this place home, we share histories of colonization and cultural resilience. We stand in solidarity with all Indigenous communities. We commit to contribute to the Shumi land tax, include Ohlone voices in our work, educate our communities about Indigenous histories and sovereignty. We invite you, our partners and neighbors, to join us by learning, giving, and amplifying Ohlone voices. This acknowledgement is offered in collaboration with local Indigenous partners, and will be revisited annually as these relationships deepen. Next slide, please. And so I would like to introduce now Lafa Tamwepao, who is the Executive Director of Taulama for Tongans, who will share a welcome and introduce herself. Thank you, Lafa.
Thank you, Lucy, and thank you very much for all the work that you've been doing, as well as other people that have participated. It is an honor for me to join this meeting. And back in the year 2000, Taulama came into being, and it's not because I was such a brilliant person that I could foresee that the needs. No, it's because there were people that were here at the time that kept on pushing for me to start this organization. And I am speaking with love in my heart because a lot of these people have gone on. There's Liami Osimafeaki, who's Tongan, but resided in Salt Lake City. And he was a commissioner there, and he came and he kept on pushing for this. And then there is Dr. Tauelangi Kefu, who's also passed away, and Reverend Dr. Devita Mohenoa Puloka. And those are some of the people that were part of this journey from the very beginning. I am humbled by joining you today and trying to share my story, which is the story of my people. I had no knowledge of this kind of work. That's not what I went to school for. And I was very hesitant in doing this work. But William Yafiaki, who was like a little brother to me, and you know, if we all have annoying little brothers, that's what our relationship was. And he kept on pushing and pushing till I finally gave up and decided to do this. Most fortunately, there is Nurse Melieni Talakai, who is working then for the county of San Mateo, and was one of the people that was instrumental in making sure that the Taulama worked. The word Taulama means to guide, and I'm told by the expert it is a biblical term. And so that's why we chose Taulama for Tongans to be the name of this organization. Without prior knowledge of all this work and the needs for this work, I came in blind, but I was willing to learn. And I found out the shortcomings, the health needs of my people, and how neglected they were. We came from an island with the idea that we would come here and try and get a better life. And so we came to the United States. Everything was new to us. The right side for you on your streets were the wrong side for us. Going grocery shopping for us was a very simple thing. You just go and then you get a loaf of bread, maybe a pound of sugar, and then you go home. In here, you had to go in and you had choices, and we weren't prepared for that. But we struggled because we were so gung-ho about being part of this country and trying to learn from this country. But we also realized that if we wanted to help ourselves, then we need to help ourselves first before asking other people to help. We were fortunate because we had our Samoan brothers and sisters who were already here, who were already established. And so they took our hands and helped us along, taught us. They were our family. Because don't forget, we came from Tonga, where we traveled the wrong side of the road, drive the wrong side of the road, and everything was just about the opposite of what it is here. We were flabbergasted when we saw how great this country was. We are so used to an island that you can look at the ocean every time you pop your head out. But we're here, you can travel miles and miles and miles of land and not see the ocean. And those are just of a few things that was very new and very strange to us. But we decided to come, and we decided that the only way we can survive is that we try and adjust and we try and learn. We may not have done much, but I think we've survived this far. And I am indeed honored and grateful for all the people, all the experts in these fields who have given us a hand and try and help us. Edith, you're always in my heart, because you're instrumental when I am not comfortable, when I want to give up, then just looking at you encourages me to go on. And I look at Nani. Nani is like a child for me. And I look at all the people that we have traveled with, that we have shared this journey with, and I'm grateful to God that he has put people like these people in my path so that I can learn, so that my people can survive. And I want to thank you all. I want to thank you. I want to thank the experts on the field. And I can't go and I can't say names because I really don't know all of you. But whoever you are, if you're in this meeting, thank you from the bottom of my heart. And so Taulama has been going on since the year 2000. And I'm encouraged because we have people like Alice Tulua, young people who are taking on the fight. And we have young people like Nani. We have Celia Fifita. And they're to carry the baton, they're to carry the journey. And to go into data, that is like talking French to me. I didn't know what data was, but I'm finally learning what it is and how important it is for the work that we do. Because like Lucy was saying, without data, I don't know. We're not doing our conversations island style. We'll come and tell my story and you'll believe me. In this country, I have to back that up with the data. And so thank you for those people who are the experts of data. Because in my 80 years old in this earth, I finally learned what data was and appreciate what data is. So I think Lucy gave me 3 minutes. I don't know how long I've been speaking now, but I must stop because you'll say, Mom, I gave you 3 minutes and you took 5 minutes. But thank you, Lucy, for picking up the baton and carrying on the fight. I know you and I clash because I am from another era and you're American, more American than Tongan. But I have to drill onto your head that you were Tongan first before you became American. So, oh, I forgot something. My pronouns, which is something totally new to me. So I'm told I am she or her, and her or something like that. So one of these days I will be able to just very nicely say my pronouns without forgetting it. But don't forget, in my time, in my journey, I didn't have these things. But I am told that that is something that I should say. So thank you so much. And Lucy, okay, I think my 3 minutes is up now. But
Thank you, Lefa.
welcome and thank you so much for joining us.
Thank you, Lefa. And in case you didn't know, Lefa is also my mother. So we can all imagine how the dynamics work with that. But thank you, Lefa, for sharing and for telling the story of our humble beginnings as Taulama for Tongans. Um, and thank you for paving the way and for being an example to not only for myself, but for the young people such as Nani and Alisi Tulua. Um, we are grateful for you. You definitely are a maverick. And like I've told you before, even if you weren't my mother, I would still love you. So thank you for all your hard work and thank you for not giving up. As many of you who are in the community, uh, working for the community or with the community and what have, it's not easy work. It many times will make us question why we're doing it. But we know that it's a calling of the heart. And for us as Native Hawaiian Pacific Islanders, it truly is part of our DNA to be of service and to help others, um, because we are community centric people. Um, we always focus on the group versus the individual. Um, but thank you again, Lafa, for paving the way and for being an example. Um, so as she was saying, Talam for Tongans, how it started, but we are dedicated. We're we're an organization that is dedicated to empowering the Native Hawaiian Pacific Islander community across San Mateo County, as well as the greater San Francisco Bay Area, California, and beyond. We honor and uplift our culture, languages, and shared values through partnerships and collective action. Together with other community-based organizations, we provide culturally grounded and linguistically accessible services, education, advocacy, and resources, all with the aim of eliminating disparities advancing equity, and promoting the health, resilience, and well-being of our people. Ultimately, the vision is that we don't have to keep fighting for what should be basically given or for to all. We have a vision of our community being able to thrive, not barely survive in this country, in this county, in this state. These are very trying and challenging times, and which calls for us to be even more courageous and steadfast in our work and in our dedication to the community and to the betterment of our community, whether it be the NHPI or the global. What inspires us as a community, as a people, is family. Family. Like I said, we are a culture, community, family-centric people. We focus on the group versus the individual, which causes some friction considering that this country isn't that way. It's more individually based. But for us as Native Hawaiian Pacific Islanders, family is huge. Um, One of the things that I always like to bring up is that, for instance, in the Tongan culture, there is no word for cousin. There is no word for auntie or uncle. It's only brother, sister, mom, or father and mother. So even my uncle is not considered we don't have a word for uncle, so we call them, they're like a father. Our aunt is like a mother. Our cousins are like siblings. So for us, it's very close knit. Um, and we're attached and connected to not only the people, our culture, but the land, maintaining our culture and tradition, because it is all we have left, as well as religion and faith. Um, in Tonga, for instance, and in many of the other Pacific Island countries, um, on Sundays, everything shuts down because it's a day of worship. Um, and so for us, I we one of the key ways of tapping into our community is church. We all belong to one. That is one given way of connecting. And we are inspired by our ancestral obligation to fulfill. It's what ties us. It's living a life that we have, that we're blessed with here in America, but not forgetting where we come from. We are connected forever to our roots. And there's that saying where you can't know where you're going if you don't know where you came from. And we're very attached to it, and that's how we live our lives. And we've come here to this country for a better future for our posterity. Next slide, please. We are, even though we're here in the United States, we're still forever connected back to the islands, through faith, through our culture, and through family. Just because we moved to the United States doesn't mean that we have neglected our families back in the islands. We're still sending money home. We're still sending aid back, sending parcels and what have you, because there's this in Tongan, it's called mo'ui ngailoa, which would mean like a life that's for like living a life of forgotten, or that you've forgotten where you came from. And that's like a huge disgrace to the family if one forgets their roots, forgets where they come from. And so it's a point of being humble, of humility. And that is one of the cornerstones of our culture as a Native Hawaiian Pacific Islander community, is to have respect, to be humble, to be like helpful, like community wise, and then to always be what's like connected, to always want to be like the connection is huge in our culture. Next slide, please. So our migration story is very similar to many other cultures and communities that have traveled to the United States. For many of us, or many of our cultures, it's through faith, through the religion. So with like the LDS Church, which is the also known as like Mormon, Hawaiians and other Polynesians migrated here in 1889, and they lived in a town in Utah called Iosepa. Samoans, there's because there's American Samoa, which is a U.S. territory, and then there's Samoa. And many of Samoans were involved with the World War II, and many have come to the United States through military. For Tongans, it was in the mid 60s, and that came through church sponsorships. However, the Bay Area served as a bridge to the United States. And one thing that is common with our Native Hawaiian Pacific Islanders is that you will find a huge population of Native Hawaiian Pacific Islanders at many of the airport hubs, and who work for the airlines too. So like San Francisco is one, Seattle, Dallas, Fort Worth, Utah, Salt Lake City. Um, and a lot of it is because of the flight benefits and being able to travel. And so you'll probably see a lot of Native Hawaiian Pacific Islanders at the airports working on the ramp or in cargo. But yeah, so the Bay Area did serve as a bridge. That was one of the first stops before venturing out to the rest of the country. Next slide, please. Um, so as I alluded to at the beginning when I first started speaking was we as a community and Native Hawaiian Pacific Islanders have had a challenge with not being seen in the data, and it still continues to be an issue, a barrier, and it hinders us from many things, such as funding, such as getting programs or initiatives addressing our needs. Um, this quote is very true. You cannot serve who you can't see, and unfortunately, currently, in San Mateo County, we as Native Hawaiian Pacific Islanders are still not being seen in the data that is collected, uh, not only from the U.S. Census. I mean, there's some, but it's we could do so much better. I know that for San Mateo County, they have the Altogether Better dashboard, which has some disaggregation, but even kudos to us for separating Native Hawaiian Pacific Islanders from the Asian uh, population. However, there there needs to be more disaggregation because the needs of the Tongan community differ from the needs of the Samoan and differ from the needs of the Fijian. Here are the top 10 counties in the state of California with the Native Hawaiian Pacific Islander population. Um, if you notice, there's the alone population, which is those that self-identified as just a Native Hawaiian Pacific Islander alone. And then there's the population total that has the alone and in combination with another race and ethnicity. You'll see that San Mateo County is number 9. And I just want to draw your attention to the Native Hawaiian Pacific Islander population alone or in combo is 14,239, while the total population alone is 9,302. Next slide, please. In the county of San Mateo, this is the breakdown for the different jurisdictions in San Mateo County, and the population, the NHPI population in each of those cities. San Mateo, the city of San Mateo has the highest number of NHPI, followed by East Palo Alto, and then South San Francisco, San Bruno, and Daly City. So we know that San Mateo County is large geographically. And so even within specific NHPI groups, the needs of those that are in the northern part of the county differ from those that are in the southern part of the county versus those that are in the central and even those that are in the coast. And to lump us together is a huge disservice because, again, our needs are hidden. Next slide, please. So there's this living wage calculator that MIT has has created, and it allows them, for them to figure out what the living wage is for any county in the United States. For San Mateo County, um, and this is not broken down by race or ethnicity. This is just for anyone that would live here in San Mateo County, regardless of race or ethnicity. They would need to make $34.76 per hour and have no children in order to live in San Mateo County. San Mateo County is, I believe, the third richest county, or yeah, third richest in the state, and I believe the fourth in the country. And the fact that this is how much it costs to live here, or to be able to survive here. But if just looking in comparison to the poverty wage, which is the federal poverty, is $7.52. And then the minimum wage that the county has approved, the ordinance, which only applies to unincorporated San Mateo, which $16.50, which is still like 50% of what is said that one needs to make in order to live here in San Mateo County. It's insane. And we wonder why. The struggle is real here. And definitely for our community. For next slide, sorry. For the Native Hawaiian Pacific Islander, median household income based off of the San Mateo County Altogether Better dashboard states that it's 106,507 median household income, while for the total population for San Mateo County it would be 154,846. And we're not one of the we're at the lower end of the spectrum when it comes to compared to all the other ethnicities in this county. But I also want to draw to your attention to the fact that these numbers are based off of those that identify as just Native Hawaiian Pacific Islander, or just Asian, or just American Indian, or Black African, like not in combination with any other ethnicity or race. And I would like to say that that is so behind the times, considering that that's not where it's a melting pot here. And if we are not able to if we continue to separate by alone versus in combo, that number of other race or 2+ races is going to grow, but it's never going to truly help us identify who's in that group. Next slide, please. From the census, from the American Community Survey, the household income, 35% of household income, 40% of the total population in San Mateo County use 35% of their household income for rent. Last time I've been aware is that the formula is like usually 30%, but 40% of the total population of households income is used for rent. Disaggregating the Native Hawaiian Pacific Islander, 40. So it looks like that they're in line, that we're in line with the total population, which is still a huge amount. I don't even know, like that's a lot, that to spend over 35% of your income on rent. And then for Tongans, just if we were to disaggregate, we would see the disparity of the fact that 58%, almost 59% of the Tongan community is using 35 or more % of their income, household income, on rent. Couple that with all the other expenditures, like how does anyone survive? And just for just to let everybody know, like we're not CEOs, we're not engineers, we're not scientists or doctors, or anything. We're not at the higher end of the spectrum when it comes to employment. So we will never make, and it's screaming the need for economic restructuring and just focus on building that part of having economic stability. Next slide, please. And so here's the biggest shocker, I guess, is that the per capita income for NHPI is 31,876. That is 50% of what it takes to live in this county, based off of the living wage, that MIT calculator, which stated that it was 72%, or sorry, 72,000. But without having this disaggregate, or this data disaggregated, no one will look at it, or no one will see us and see that we need help. We will continue to barely survive, not even thrive. I used to think that the American dream was going to be attainable. I thought it was for my parents, but now I'm seeing it's becoming further and further away. And at this point, I don't even know if it's an American dream anymore. But when our income is this low, and we're not even making it, it is hard to focus on health, because it's not a high priority. If my community is worried about having food on the table for tonight, or a roof over their head next month, health falls on the wayside. It is hard to try to survive when it just seems like everything is just stacked up against us. Barriers, whether it be linguistic, cultural relevancy, it's not working, it's not helping. And then priorities start falling apart, because the only priority is just to meet the basic needs. Next slide, please. So in response to what we saw, Taulama is as a nonprofit, community-based nonprofit that has focused on health, specifically health outreach, health education, advocacy, all that, which is truly important. Health is important to live. However, when basic needs are not being met, health becomes the 10th priority. Food and making sure that we have housing or a roof over our head becomes the number one priority. And if I have to miss work in order to go to a doctor's appointment, I'm not going to my doctor's appointment, because I need to make money. Because majority of the jobs that our community has doesn't, like, they don't have benefits such as sick days or vacation, or and so even the health of children become a bottom priority, because that again means missing work. So we piloted this financial empowerment program earlier this year, which is had an 8-week curriculum, one class a week for 2 hours in person, which was coupled with a one-on-one session with a financial counselor each week. That financial counselor and that one-on-one session was used to go over what was discussed in that class, along with preparing for the next class, and to address any financial goals that were set, and to strategize about how to achieve those goals. Along with that, there was a financial incentive after after the participant completed at least 4 of the classes. And with this pilot, we had 12 Tongan participants and 4 Tongan financial counselors. And the amazing thing was that I know that financial institutions have these types of classes, like you go to Wells Fargo or credit union, and if you're a member, or banks that with them, they'll offer you these classes. However, what made this better or more special was to take it from a very popular brand that was in the 90s, but I know it still exists now. It was FUBU, which is this was for us by us, and it was a welcome experience, because the financial counselors were able, because they were Pacific Islander or Tongan, they understood the financial or the familial obligations that we have, and there was no shaming around it. Because I know growing up, many people who were not of my culture used to question why we helped with a school, or why we helped with building a church, or why we sent money back home and all these things. But um, and it got to the point where it was felt shame. I was ashamed, you know, like, and sadly, I was ashamed to be part of my culture, because I was, why can't we just be American? Why can't we just be like everybody else? It wasn't until much later in life that I realized the beauty of our culture. And I will say that my culture has saved me. I get irritated by my culture because we're always in each other's faces and there's always family around. But from a perspective of a person who deals with depression, um, and suicidal ideation, being alone is the last thing that one in my position should be in. Um, and as annoying as, and I love my family, but as annoying as they are, they have helped me because they were around, they were there. And so um, this class helped with just normalizing what we already do, what we already experience. And uh, the financial counseling helped them just feel heard and understood. And so all of this that I've said is to say that the disaggregation of the data, we've done well as a county of San Mateo has done well, and UCLA Center for Health Policy Research has provided us with this wonderful tool of the dashboards for our counties, but we could do so much better, because without further disaggregation of the data, huge communities will continue to still be invisible, and they're and not seen and not heard. And with that, I'd like to pass it on to Calvin to share the tools that UCLA has made for us.
Thank you very much, Lucy. Just going to be putting our slides up. We're extremely grateful to Taulama Fratalians, Lucy, Leafa, for the opportunity to present, and we've always honored, your willingness to partner with us and this opportunity to share some of the data tools that we've developed for Native Hawaiian and Pacific Islander communities in California. The tools that we've developed were funded by the Office of Minority Health through our project Addressing Health Equity in Data, otherwise known as the Unheard project. The Unheard project emerged out of the need to ensure that our NHPI communities had access to whatever data does exist for our communities. Whereas many data tools are often developed behind closed doors by those who specifically work with data and perhaps with software developers that may be disconnected from the community, we wanted to ensure a process that included community throughout. And these included taking into account what the community's current capacity is for working with data, so we could meet them where they're at, and also making sure that the content was directly relevant for the work our communities were doing, and make sure that we prioritize what the community wanted to share. We managed to wrap this in an iterative feedback loop that allowed features to be added to our data tools over time. And just as one example that we'll go into a bit of detail more later, some of the content that we've included in some of our tools that we've developed include considerations that are very relevant for relatively small communities like Native Hawaiians and Pacific Islanders. For example, we understand that small sample sizes often mean that our data isn't reported, or whatever statistics are provided are unstable. So we started this project with a community needs assessment that included over 30 community organizations that are NHPIs serving from across California. And they expressed a universal need for timely and accurate NHPI data across a broad range of issues, including health, the environment, economic issues, and housing issues. They also shared that their top uses for data, if they had access to it, would include community education presentations, program development, grant writing, and policy advocacy. We also learned that it wasn't enough to simply provide data to the community. Support is needed to connect data to those data uses, so we developed a series of data trainings specifically for our communities. The foundational data trainings that we developed goes over understanding fundamental data concepts, how to find data, and how to use data for those purposes that were prioritized by the community. And since then, we followed up with intermediate data trainings that take a deeper dive into how data can be used in policy advocacy and creating basic data visualizations. Just one example of the policies that our community has been organizing around recently has been OMB Statistical Policy Directive number 15, and how one of the changes to federal race and ethnicity standards has included default detailed race categories that would add Tongan and Fijian to the checkboxes that that the Census Bureau's forms has been using, but for that change to be applied across all federal agencies. And one of the pieces of one of the campaigns that our community has been involved with throughout various counties in California has been to try to bring the state and county agencies in alignment with Statistical Policy Directive 15. And just to highlight the example of how our trainings were tailored for our communities, our curriculum goes over the concepts of surveys and why NHPIs find it so hard to be represented in survey samples. We also go over how tools like the California Health Interview Survey enables users to easily pool samples across years to try and obtain more stable estimates and potentially overcome privacy thresholds in order for our community to be able to see ourselves in the data. We've also introduced a dashboard that provides our communities with California county level data from numerous sources, including the Census Bureau, state agencies, and the California Health Interview Survey. These tools and others aren't just for San Mateo County, but also for our communities in other counties as well, whether it's Alameda, but we will also be expanding the number of counties that will be available on our current dashboard as part of an update that our research data manager, Shreya Paul, will be sharing about now.
Thank you for the introduction, Gavin, and I'm very grateful to be a part of this webinar today. Thank you to Lucy and Lefa for inviting our team to present on our data tools. So today I'll be talking about the Native Hawaiian and Pacific Islander social determinants of health dashboard and county data profiles, which we have developed at the Data Policy Lab. Next slide. So we already had the Native Hawaiian Pacific Islander SDOH dashboard for California counties, but we have been working on an exciting update. Our dashboards have a new look, and our team has designed the dashboard to be more user-friendly, visually engaging, and informative. Next slide, please. Additionally, we have also updated the dashboards to use the latest available data on data.census.gov for our communities. Next slide. So the dashboard development process is an iterative process, and for this iteration, we have released statistics and visualizations for the top 10 counties by NHPI population, which includes the San Mateo County. Next slide. Our dashboards contain data for the following indicators. We have statistics available on demographics, voting age and gender, prevalence of disability by race and ethnicity by NHPI age group, economics, including poverty, income, education, K-12 education, higher education, health, such as general health status, insurance status, etc., housing, statistics on home ownership, marriage, living with relatives, and veteran status. Next slide. We have also optimized our dashboards for viewing on mobile browsers, so there's no app needed to view our dashboards on the mobile. The browser is sufficient. Next slide. And our dashboards can also be viewed on tablet and landscape view. Again, there's no app needed, and the browser on a tablet is sufficient. Next slide. Now I'm going to be putting a link in chat to access our dashboards. You are welcome to go through our dashboard, and if you have any questions, you can ask us during the Q&A. Next slide. So the next data product that I'm going to be talking about is the NHPI Social Determinants of Health Data Profile. So this profile draws from our interactive dashboard and provides a snapshot of health and well-being across NHPI communities using detailed county level data. Each data profile is 3 pages long. The first 2 pages present subgroup statistics for the county. In this case, the Alameda County, and the third page provides data sources as well as any data notes. Next slide. Each profile presents data specific to counties with significant Native Hawaiian Pacific Islander populations. Using the profiles, you can provide a quick snapshot of the diversity within the NHPI community. That is statistics for Native Hawaiian, Samoan, Tongans, Pigeons, Chamorros through subgroup level data. Next slide. Topics include demographics, education, income, poverty, health, housing, and disability. Next slide. We have given this a visual and accessible format. Graphs, maps, and charts make complex data more understandable for community use. Next slide. And the data profiles are tailored for action, which means that it can be used by local leaders, advocates, and residents to identify disparities and drive policy or research changes in their communities. Next slide. You can contact us if you need custom profiles for any specific counties, and I know that we are going to be working with Lucy to come up with a data profile for San Mateo County. But for now, I'll just paste a link of the Alameda County profile in the chat. And with that, I'll pass it on to Kevin for the Q&A.
Calvin, there was a question in the chat about is level of information. Shanice, did you want? We can so is level of information we can access ourselves?
Yeah, I was asking, do we access that ourselves, or do you have to send us the profile like you did for Alameda?
So
Like
we've currently developed 3 data profiles, almost like a proof of concept in terms of how various counties can have their data and what they look like in these profiles. But we've developed a template that organizations can use to fill in themselves using data from the dashboard. And we're happy to set up one-on-one meetings with organizations or individuals that would like these data profiles to be developed for their own counties, so that if there's particular data they would like from our dashboard to be put into the profile, we can walk people through how to do that themselves. because we understand that perhaps organization priorities can change over time. You may want to swap things out, and we would much rather use this as an opportunity to show folks how they can put the data in that they would like to see. In case there are changes over time, they don't have to keep coming back to us. They can simply do it themselves as well. So
Okay.
please feel free to reach out to us, and we can help you utilize our template that we'll also be posting online to populate with some of the data.
Okay, and last question. I know I'm here with Taulama for Tongans, and I think this is absolutely wonderful, and I think this is what the community needs. Do you do other cultures or identities or anything like that?
So currently we're focused primarily on Native Hawaiian and Pacific Islander communities. It's just been our community's been relatively underserved when it comes to the development of products that are specifically geared towards our community's priorities and ensuring that our community is represented accurately in data sets. So for now, we really hope to focus on NHPI data, but we may also be able to point you towards other resources or folks in our network for other communities that have similar concerns. We've been in touch with some Native American advocates that have been interested in making sure that that data products represent them as well.
Okay. Thank you so much. This is wonderful. Thank you.
Thank you, Shawnice. And there's another question, Calvin. This is from Jason Finaus. Is it possible to get the list of PI serving orgs across California that your team worked with on the community needs assessment?
Yes, we'll be sharing a copy of our deck, and it'll contain that slide with a list.
Thank you. Oh, and then Edith, I see. Okay, you saw the answer to your question about putting. So I will be meeting with Calvin and Shreya to create the profile for San Mateo County, and then I will definitely share it with everybody that registered for this webinar. But if you have any specific needs or you'd like something specific, just let me know. I'll put my you'll get an email from me, so then you'll have my contact information.
Lucy, I have a question for you. How are you sharing this information with the cities where our Pacific Island, I'm thinking of East Palo Alto, Menlo Park, and Redwood City has quite a few Pacific Islanders, so does, I think, South San Francisco. So are you going to those cities to share this information to raise awareness? Like,
yes.
What's the plan?
So I reached out to each of their city council members for each of those cities, because I went for the top 6 cities of San Mateo County that have the most NHPI. And I was starting off with that way, but then also reaching out to the organization, PI focused and PI led organizations, or ones that help Native Hawaiian Pacific Islanders, and making them aware of this information. Because even though there's a lot of organizations, not all of them serve specifically or our community, but just having them be aware of the tool, which is what this webinar was about too, was because I can only fangirl for data with UCLA so often before they get tired of me.
Yeah. I'm thinking about, I know that I think there's like 3 lead PI organizations here in East Palo Alto.
Yes.
But I also know that the city's doing work, and we actually got a homeschool organization that's led by Pacific Islanders. So I'm wondering well, you can call me if you need help in East Palo Alto.
Whatever I got, I'm sharing with you. But yes, I did reach out to East Palo Alto City Council and the organizations in East Palo Alto that are Pacific Islander led and focused, and invited them to this webinar. But yes, I will definitely reach out to them again and share with them the information.
So
sharing is caring.
So I just want to put out Calvin, you said you offered for people to contact you to learn about how to use the template. It seems to me like that needs to be the next training, maybe not one person at a time, but if you could put together a training that is available statewide, so any organization that might be serving the Native Hawaiian Pacific Islander community can come and learn how to use the template. That might be I would consider that a really beneficial training.
We would love to provide those trainings as well. So the grant that this project emerged from, unfortunately, the end of the grant period is the end of this month, but we will continue finding resources to help folks utilize our trainings. Those will be posted online. But I think that's a great idea. It would definitely, I think, help things run more smoothly, even if they do eventually need one-on-one assistance. That training would be a great help too, I think. But I think that's a great idea. I also just wanted to acknowledge that I believe I saw Tao in the room, and I just want to acknowledge that Tao is one of our data champions and is currently serving on the California Asian Pacific Islander State Commission, and I believe is the lead of the Regional Pacific Islander Task Force. And very nice to see you here.
It's good to see you, Tao.
Thank you. I know we're over time, but I really appreciate everybody that stuck it out with us. I know we started also late, island time. But if anyone has any other questions, please put it in the chat. If not, you will receive an email from me. It will contain the recording of today's webinar along with the slide deck. And the surprise was going to be the San Mateo County profile. So it'll be all those things. And please feel free to reach out to me. And if you have any questions or if there's something that you need or I can connect you with anybody, then please let me know. Thank you again, Lefa. Thank you, Calvin, Shreya, and Kristen for being here and for helping me through this. It was nerve-wracking, but thank you for sharing the tools that you have, Calvin and Shreya and Kristen, because you have definitely made me a data nerd. Thank you, everybody, for joining us. I remember everyone's names, and when I see you, don't be surprised when I hug you, because I'm going to hug you, because you being here really warms my heart. And even if you were voluntold to be here, I still appreciate you being here, because it takes a village, and you are part of our village. So thank you, everybody, for being here, for learning with us, for hearing our story and hearing our asks. And I hope you all have a wonderful rest of your week. Happy Hump Day. Thank you.